because I took this video presentation at night, so good night to all of us and best wishes. My name is Gerald Batubara. I'm a medical student from Bengkulu University. Today I will present the result of my study on the trend of diarrhea in Kodi and Kodi Utara sub-districts, Sumba Barat Daya district in 2013 and its related factors. Okay, first we get the introduction. Diarrhea is one of diseases with high number of incidents in the world, particularly in developing countries. Morbidity and mortality of this disease are still high and occurs among all ages, although children found to be more susceptible to suffer from diarrhea, and the mortality of diarrhea is higher in children. Diarrhea arises due to poor level environments, sanitation, hygiene behavior, and clean water. It may prolong and complications such as dehydration and malnutrition will eventually appear and lead to death. In Indonesia, diarrhea is also one of the most common problems in the population due to the increasing trend almost every year. A survey conducted by Ministry of Health showed that there was an increasing trend of diarrhea from 2000 to 2010, especially in Nusa Tenggara, where the incidence of diarrhea is more than 9%. The most probable reason of incidents likely due to bad sanitation and low knowledge about diarrhea. The absence of clean water may also lead to many infections and hygiene behavior in the population. Sumba Barat Daya, or SBD district, is one of area in Nusa Tenggara Timur which has limited water resource and bad environment and sanitation, including Kodi and Kodi Utara sub-district. In Kodi Utara sub-district, residents have difficulties to get water, and on the other hand, people of Kodi can get water easily for their daily activities from river. Therefore, this study wanted to know the trend of diarrhea in Kodi and Kodi Utara and the relation between age and the availability of water resource with the disease. Okay, second is the method. This study used cross-sectional design without any intervention. Collection of data was taken in June 25, 2014 in Health Department District of Tambolaka, Sumba Barat Daya. The whole study was conducted for 8 months. Data for the research was secondary data taken from Health Department District of Sumba Barat Daya. The target population was all population in Sumba Barat Daya in year 2013. Data was divided into 3 age groups: less than 5 years old, 5 years old until 14, and more than 15 years old, and 2 areas. To analyze the data, this research used chi-square test to see the relationship between prevalence of diarrhea and age and the availability of water resource. The sample of the study was all population of Kodi and Kodi Utara subdistrict who met the research criteria. Prevalence is defined as number of diarrhea per year divided with number of population in Kodi and Kodi Utara. The dependent variable was the prevalence of diarrhea in Kodi and Kodi Utara, while the independent variables were patient age and diarrhea. So the third is the result, as we can see from the table 1. Kodi Utara has greater area than Kodi, as well as the total population. In both areas, male population are outnumber female population. The average populations in both districts are people with range of age between 15 to 44 years old. Table 2 presents number of diarrhea patients in Kodi and its prevalence among population in different age group. The prevalence of diarrhea in Kodi found to be higher in population less than 5 years old compared to the other age groups with 0.9%. Table 3 shows data of diarrhea patients in Kodi Utara. The table states the highest prevalence of diarrhea occur in this subdistrict belongs to the same group of as Kodi. From the two tables, Kodi Utara has higher prevalence of diarrhea compared to Kodi in 2013 with 1.8% and 1.7%. Table 4 illustrated a comparison between prevalence of diarrhea in Kodi and Kodi Utara and related to water availability from number of patients. Kodi Utara had received 898 patients during 2013 in their local primary healthcare number. Kodi district with only received 524 patients. Figure 1 and Figure 2 show the trend of diarrhea patients in both specific districts throughout the year. From Figure 1, the highest cases throughout the year of 2013 were in January and May. However, the least proportion of diarrhea patients in 2013 were found in June and September. The age group found that population below 5 years old dominantly suffer from diarrhea. The lowest age group with diarrheal disease was found mostly in patients with range 5 to 14 years old. Figure 2 shows the trend of diarrhea found in Kodi Utara subdistrict. The highest cases in 2013 occurred in April and September. The lowest cases in Kodi Utara in December, with only 552 patients. The most frequent diarrhea cases remain occur in population with age group less than 5. The fourth is discussion. First, trend of diarrhea in Kodi, Jawa Barat Daya in 2013. From the current study result in 2013, Kodi district had a fluctuation trend of diarrhea because seasonal factor. From the age group, it shows that the highest frequency of diarrhea throughout the camp from the group of children less than 5 years old. Number of diarrhea cases in Kodi's infant seem to be higher because their susceptibility to suffer from infection, including diarrhea. Secondly, it was undoubtedly due to mothers' habits were still far from good hygiene level. The third one was because the environment that was not clean enough. On the other hand, lowest frequency of diarrhea through the year came from patients ranging between 5 to 14 years old. It was because of this age group has ability to go to the river easily. Secondly, these people are primarily consisted of school age to teenager, when the information regarding awareness towards hygiene is usually provided by the local government or even school. Uh, the second is trend of diarrhea in Kodi Utara, Sumba Barat Daya 2013. Kodi Utara district show also an unstable trend throughout the year. The highest number of diarrhea cases in the district appear in April and September, and the lowest proportion was in December. Kodi Utara has inadequate environment to live. The environment surrounding the house is not decent enough for a living. The habits of washing hands before and after meals, or even after etiquette, are not applied in the local society, probably because by the unavailability of water resources due to low rainfall rate and no drainage under the land. This makes Kodi Utara has higher prevalence of diarrhea compared to Kodi in 2013. Third, association between prevalence of diarrhea and age. Diarrhea infection would not stand alone without any trigger. there are many factors that contribute to diarrheal disease, such as economical status, social, and environment. The current study has proved uh, that in both districts, Kodi and Kodi Utara, there were significant difference between diarrhea and age group, meaning the prevalence of diarrhea was associated with age. Kodi and Kodi Utara saw frequency of diarrhea in 2013 were higher mostly in children under 5. And fourth, association between water sources and diarrhea. The prevalence between Kodi and Kodi Utara show that Kodi Utara was higher than Kodi. Kodi Utara has limited water resource and low rainfall. Therefore, we consider water as one of the necessary factors that might contribute to diarrheal disease. However, unlimited and reachable water resources are not included into this factor. Okay, so the last part is conclusion. The trend of diarrhea in Kodi and Kodi Utara found to be fluctuated in 2013. A large number of diarrhea cases in Kodi found in January and May, while the small number found in June and September. On the other hand, the most frequent diarrhea cases found in Kodi Utara were in April and September, while the least frequent was in December. Diarrhea cases in Kodi and Kodi Utara mainly belong to population below 5 years old. The prevalence of diarrhea patients in 2013 was lower in Kodi compared to Kodi Utara. The study found that there was an association between prevalence of diarrhea with age of patient and has relation with the availability of water source. Okay, that's my presentation about this study. Thank you.